With every trial, every test, we move closer to the rest. A world where pain no longer stays illuminated by brighter days. Waits for a cure. Rise and shine, rise and shine.
Thank you, Louis, and thanks everyone for allowing us to be here. My name is Gaston de Visich. I'm what's standing between you and your dessert, so I'm so sorry. It's a great honor to be able to represent the Lac-Cura, which is the HIV cure consortium in Latin America and the Caribbean. And now after the Super Bowl and the halftime show, when Bad Bunny listed Canada, welcome Cancure to the team. I'm the community engagement representative at Fundación Huésped, which is an NGO with a clinical research site in Argentina. My work sits at the intersection of community engagement, research, and policy. And today I want to share with you not only what Lac-Cura does, but why it matters. And also I'm joined here today by another member of the consortium, which is Luciana Camel, Senior Coordinator of Community Engagement in the Fiocruz Center in Rio de Janeiro, our host for its conference in July. To get things going. Can you see? Change the slide. There you go. Well, Latin America is often known as the forgotten region. We are rarely the focus of funding strategies. We are often also framed as a region of implementation, not innovation. Also seen as a place where interventions are deployed, not where scientific agendas are shaped, as places where studies are conducted, but not where priorities are defined. And in regards to HIV cure, we are rarely centered in its roadmaps, and that this invisibility does not reflect a lack of capacity. It reflects a lack of structural inclusion. And Lac-Cura was created to challenge that notion. Today, I will present to you 4 areas. First, an overview of the current landscape in LAC, which I don't necessarily expect you to know, and how the structural challenges that continue to shape both the epidemic and the access to scientific participation. Then I'm going to give an overview of the paradox of HIV cure in the context of persistent global inequities, and why participation in cure research is also a question of equity, but mostly sovereignty and preparedness. Then how Lac-Cura emerged, why it was created, what is this evidence revealed, and how it's working today to connect and strengthen the regional ecosystem. And finally, the strategic role that LAC can play in the future of HIV cure research, and the window of opportunity we now have to help shape that future. To begin, I would like to start giving you a bit of context of our region. LAC occupies a unique position in the global HIV response, because on one hand, we have achieved major progress in the response. Many countries have built strong HIV public programs with widespread access to ART, often delivered through public health institutions. Today, approximately 2.5 million people live with HIV in our region, what represents 6% of all the people living with HIV globally. Over the last 2 decades, treatment expansion has led to a significant decrease in HIV and AIDS-related mortality, actually at 31%, and a reflection of public health infrastructure, sustained activism, and political commitment across the region. But you know that this progress is always fragile and uneven as it coexists with persistent and deeply concerning challenges. New HIV infections have increased by 13% between 2010 and 2033, particularly among key populations such as MSM and transgender women. In some settings, stigma, criminalization, and structural barriers like poverty, violence continue to limit access to prevention and care. And now these challenges are fueled by the growing influence of the anti-rights and anti-gender movement, as well as political shifts in some countries toward more conservative governments, which began to question and backroll policies that support sexual and reproductive health and rights to key populations. This creates a landscape not only defined by progress, but by persistent and evolving inequality. And in these inequalities do not only shape who has access to HIV services, but also who has access to science itself. That takes us to the fundamental and often uncomfortable question of how do we talk about HIV in a world where inequities still define the present? Because as we were saying, HIV exists, inequality exists in HIV, in also who defines these agendas, who leads the studies, and who receives the funding, and in whose priorities are reflected in the future of the field. This matters deeply because cure will not arrive suddenly as an universally accessible intervention. It will emerge gradually through research, trials, pathways, and implementation processes. And regions that are not part of this risk being left behind. So if we're not part of the science, then it's not likely that we will be part of a future shaped by that science. Therefore, participation in the research is not only a scientific issue, rather than, as I said in the beginning, as something of sovereignty, preparedness, and equity. And it's about ensuring that cure strategies become viable, that when that happens, our regions are ready, but not just scientifically, but also socially and politically. Our region faces a structural vulnerability that is often overlooked, even though it is shared by much of the global south, which is a scientific dependency. Most of the technologies we use, drugs, diagnostics, and a future cure strategy are often developed elsewhere, which creates a fundamental asymmetry in who generates knowledge and who implements it. LAC has contributed enormously to HIV research through clinical trials, cohort studies, community engagement, and implementation science. But these contributions have often been fragmented, under-recognized, or peripheral to agendas largely defined either in the global north or in adjacent to the global North Africa agenda. Lac-Cura emerged as a response to this gap, as it's the first. Actually, in the history of HIV response in Latin America and the Caribbean, is the first consortium built by people from LAC, for people from LAC. So that into itself is a feat. Now, what have we contributed already as a region? You can find more information about this work in the QR codes that are shared on screen. It's important to emphasize that LAC is not entering the HIV cure from the margins. We've already been making meaningful contributions. Two landmark cases were documented and published in 2021 in Argentina, the first known as the Esperanza patient, an exceptional elite controller in whom researchers were unable to detect intact HIV genomes after extensive analysis. And the second is the Buenos Aires patient, which is a post-treatment controller who has maintained viral suppression for years after discontinuing ERT. In addition, there's many research groups amongst the region, particularly in Brazil, Mexico, and Chile, who have contributed to reservoir science, immunology, and interventional studies. And these examples demonstrate how our region is not merely preparing to participate in cure research, but we have already been helping to shape its foundation. The challenge now is how to ensure that these contributions evolve into sustained regional leadership. So that takes us to the question of who are we? Lac-Cura is a regional consortium with one goal: to strengthen the capacity of the region as an active, visible, and influential actor in the global cure research movement. It was initiated in 2022 by a group of researchers, clinicians, and community members from the region who were already working often in parallel in issues related to cure and long-term control. And what brought us together was the shared realization that without regional coordination, no country was going to be able to do this alone, and that our voices, priorities, and realities would continue to be underrepresented. And shortly after its inception, we received a grant from the AAS and AVAC that enabled us to formally launch the initiative and move from concept to structure. This was, of course, instrumental in transforming that shared concern into an organized platform that allows us to map the field, define our principles, and articulate a forward-looking roadmap. Since then, we've grown to 15 members from 7 countries: Argentina, Brazil, Chile, Colombia, Mexico, Peru, and Uruguay, building a coordinated regional platform where previously there were mostly isolated efforts. Lac-Cura is a multi-sectorial group, bringing together the audiences that I already referred to, but also decision makers, actors who are often siloed. And we're currently organized around 3 interconnected pillars, which are clinical, basic science, and community. And we currently have an interim governance phase that operates through consensus while building representative leadership among these structures for long-term sustainability. In addition, we have an advisory board composed of people from the region working abroad, particularly in the global north, and our aim is to balance regional ownership with global collaboration. What we've done to place the cure in our regional agenda in terms of educational activities. Since we created the consortium, around 5,000 people have participated in over 30 HIV cure training and educational sessions across the region. These sessions have brought together healthcare professionals, industry representatives, civil society members, researchers, and decision makers. And we also have participated in 9 international platforms as a consortium since 2024. Beyond professional spaces, in terms of communication, something that we are very proud of is to have contributed to shaping the public narrative around HIV cure across social media platforms such as Facebook, Twitter, Instagram, and TikTok. Our content has reached over 8,000 views. And something that we are particularly proud of is the visit that we had from Alan Castillejos, the London patient, to the symposium, the regional symposium of Fundación Huésped in 2024, that we took him into extensive media campaign, and that led to his story being mentioned around 68 media outlets, and with an estimated monetization value of his coverage, meaning what would cost to have paid for an equivalent exposure of $20,000 and an estimated audience reach of 12 million people. This matters because the cure is not only, as you know, a scientific question, it also has a political and social tone, and public understanding shapes expectations, advocacy, and accountability. So if it's not understood, discussed, and contextualized regionally, it cannot be meaningfully integrated into either policy or research planning. What we have started to produce ourselves. In 2024, we conducted the first systematic effort to understand the participation of LAC in cure research, both in terms of scientific production and stakeholder perceptions. This included 2 components. First, a bibliometric analysis of global HIV cure publications over a 15-year period. And second, a regional survey involving more than 500 stakeholders from 17 countries, should I say territories actually, including the different stakeholders. A survey that was translated into 4 languages: Spanish, Portuguese, French, and English, reflecting the linguistic diversity of the region. And what we found was both encouraging and deeply concerning. Representing 6% of the global HIV population, we also, as a region, account for less than 5% of the global HIV cure publications. But when we look more closely, the number of studies actually led by institutions from the region was even smaller. Only 150 publications over the last 15 years. That was between 2009 and 2024. Were led by LAC-based researchers, and most of them were concentrated in just a few countries, them being Mexico, Brazil, Argentina, and Colombia. This tells us that cure research capacity exists, but it's uneven and limited. Cure research in the region is fragmented and poorly coordinated. Most publications included only 1 institution from the region, which means that even within Latin America and the Caribbean, collaboration has been limited. And while some recent regional researchers participate in international consortia, leadership typically remains in high-income countries. This reflects structural inequities in leadership in science, and the question is not absence of expertise, but the absence absence of coordinated infrastructure. We also wanted to understand how cure is perceived within our region. And in this regional stakeholder survey that we conducted, we received response, as I said, from over 500 individuals across different sectors. Participants consistently identify HIV cure as a low priority within regional health and research agendas. Many reported limited awareness of cure strategies and limited access to funding opportunities. This was followed by lack of infrastructure, training opportunities, and integration into global research networks. And this is important because it reframes the problem and not being the barrier of scientific capability, but actually structural inclusion. Importantly, stakeholders were also able to identify ways forward. This included the creation of a regional platform, training programs, community education initiatives, and dedicating funding opportunities. In other words, the need for a consortium, but what we were glad to know is that it wasn't something that was imposed, but that came out articulated by the region itself. So Lac-Cura wouldn't be the starting point but an actual structural response to an already existing but disconnected system. We have the researchers, the clinical infrastructure, the community leadership, but we were lacking is coordination, visibility, and structural inclusion. Our survey also conducted the first regional assessment of civil society perspectives on HIV cure across the region. In particular to that audience, we received 365 responses from civil society members across 24 territories. And what we found was not surprising, but it revealed a lot of things. The first being that across nearly every dimension of HIV cure research, respondents reported low levels of knowledge. More than 80% reported limited awareness of the funding landscape for HIV cure. Almost 3/4 reported low knowledge of community engagement strategies and ongoing cure studies. More than half reported limited understanding of cure strategies themselves. And this is not a reflection of lack of interest, but a lack of structural inclusion. When we ask people why levels were so low, they pointed out to systemic factors. Over 70% of them stated that cure research was not simply prioritized in regional agendas. 2/3 identified limited training opportunities, and more than half said that cure research is not sufficiently visible in current HIV discussions. The study also explored willingness to participate in HIV cure trials, and here findings were equally important. The most commonly reported barrier was ATIs. Over 75% identified ATIs as a major concern, understandably, of course. But what is striking is that fear alone was not the only defining factor. When we asked people what would encourage participation, the top response by far was receiving clear, detailed, and transparent information. This is okay. 73% identified access to comprehensive information as a primary facilitator. Participants also expressed strong motivations to contribute to scientific progress and also to benefit their communities. And this is a critical point because in LAC, people are not resistant to cure research. We are cautious and rightfully so, but we are also altruistic, engaged, and willing to contribute when properly informed. And this tells us something fundamental, that education is a bridge between hesitation and participation. This is a work that actually Luciana led and that reveals a paradox that in one hand, there is a clear interest, motivation, and willingness to engage in cure research. But on the other hand, cure research is widely perceived as a low priority across all stakeholders. 70% of civil society respondents believe that the pharmaceutical industry does not prioritize HIV cure at all. 60% believe that decision makers do not do it. And nearly 50% believe that healthcare professionals do not prioritize it. But perhaps what's most striking was that almost half of civil society respondents said that the cure research is not even a priority among themselves as a stakeholder. And this finding is not like an indictment of communities. It's a reflection of this invisible structural invisibility because priorities do not emerge spontaneously. They are shaped by landscapes that being funding, that being being featured in an institutional agenda, around media narratives and global scientific leadership. Because when a region is consistently left behind, key research does not become something that's close or that's perceived close. And this is how marginalization becomes internalized. But the story does not end here, because alongside this perception of low priority, we observe something equally important, a profound readiness to engage. More than 76% of respondents express a strong interest in receiving training around HIV cure and advocacy. And yet, despite this willingness, only 43% reported that they had ever been involved in research in any capacity. This gap between willingness and opportunity is one of the clearest indicators of these structural exclusions, because communities are ready, but pathways in participation do remain limited. And the problem is not on willingness, but access. The study also explored what cure means from a perspective of civil society, and this is something that corresponds to what the last presentation presented. When we asked about priorities for cure research, respondents identified three core dimensions. First, eliminating the virus from the body, what we might call a sterilizing cure or a functional cure, was the top priority, but equally important were quality of life and freedom. Participants emphasized the importance of improving overall well-being and removing HIV-related limitations in personal, emotional, and social relationships. And civil society also articulated clear priorities for what a regional consortium would look like. The top priority, identified by nearly 70% of respondents, was to promote HIV cure among the region. The second was advocacy, meaning influencing policies and securing funding to support cure research, awareness, and access. And the third was to ensure equitable access to innovative treatments and trials, which leads us to think about what's our strategic role as a platform today. Because based on these findings, we have more of a strategic framework centered on transforming what's a landscape that looks fragmented into a coordinated agent, a visible one that can influence the regional ecosystem for HIV cure research. So our strategy is structured around 5 interconnected priorities. The first being strengthening the regional coordination and research infrastructure. The second is the expansion of equitable access to training, education, and participation, strengthening the community engagement and social preparedness, increasing the regional visibility and leadership of HIV cure agenda from the region into the global movement, and preparing the region for future implementation. Together, we know that these efforts position not only the Lac-Cura as a network, but as a structural platform to enable a regional leadership, strengthen equity in global research, and ensure that Latin America and the Caribbean can help rather than merely receive the future of HIV cure. Because preparedness doesn't start once an HIV cure is found, but it must begin now. We face, of course, important challenges. The first being the limitedness of funding. This started only as a 10K grant, and most of the things that we do come out of a voluntary basis. So us fishing for opportunities that can help solidify and institutionalize the movement are something that is of need for us. Then infrastructure varies across different countries, and capacity is uneven when HIV cure research requires long-term investment. But also, as I've said, we face extraordinary opportunities, one being decades of experience in HIV research and care, scientific institutions that are strong, and a powerful community leadership. And there's how the current scenario has hit us has not been in terms of funding directly, but also us trying to build a momentum for us as a movement in a context where money is not being prioritized in research in general, but also in cure. And to close, I would like just to say that talking about cure from our perspective as a region is not premature, but overdue in a way, and that we are ready. We have the expertise, we have the commitment, and what we need now is to coordinate, to continue partnership and visibility, and we do believe that Lac-Cura is a step into that direction. And I look forward to your questions and the discussions, and I thank you.
So you mentioned the whole thing along said Latin American and Caribbean, but I didn't really hear much about Caribbean islands, you know what I'm saying? And they're all very, you know, there's dozens of them, but they're relatively small, low population, low research, low labor and things like that. So I don't know if people, what goes on those various islands. I do believe that they all have access to ARV, but in terms of participating in any kind of clinical trial is probably limited. Of course, Puerto Rico, the opposite, because they're the United States and they have everything pretty much, the ECTG side and all of that. But also, what about Cuba? That's a big country. Do they really, does it actually talk to them? Do we know what happens there?
And you know, there's also like a lot of like key research being done in Haiti, believe it or not. And then in regards to the question about the Caribbean, it was something that we deeply discussed at the beginning, because all of the current membership is in the continental Latin America, but we wanted to make an investment to be a consortium that would include them, even though that's not something that's currently happening. And the reason that is why is because when this was born, it was an initiative that tried to be like HIV cure in our like language, and even though most of the region speaks primarily in Spanish, we have a similarly like relationship with Brazil in terms of languages. But when we started to project how our growth would be, the language barrier became something that would be essential to address. Especially because if you are trying to cover that section, then people that do not engage in a different language are lost, which was something that we were striving to at the beginning. So currently we have in our projection to not only include, but also have people from the different audiences, like community members and decision makers, be a part of our consortium this year. This is a depth that we have that it's not that we're able to solve it, but again, it's not like any of us that are part of the consortium. We do this on the side. So when we start to face the articulation problems that the region has faced before Lac-Cura, this is something that precedes us, and that it speaks about why the work is fragmented. So I don't know if I'm answering to your question, but it's something that for us is long overdue, and that we are planning to.
Do we know anything about that?
No, I mean, there's people in Cuba working on that. There's people in Haiti working on that. There's a strong community leadership movement in countries like Jamaica as well. And again, we haven't had the opportunity yet, since we don't currently have a project that we're working on preparedness. But answering to your point, perhaps this is the moment in which we should try to bring them in.
Okay, thank you. Be short. Thanks for the presentation. But I was more interested when you spoke of community preparedness as well as community engagement. I think that you do a lot of investment on that, so on the community engagement and on the community preparation of preparedness. But my issue would be on the region that, are you influencing the political will? If so, how is that? Of the political will.
I missed one bit of the last part because of microphone.
Okay, I'm saying that on the regional level. Okay, I'm saying that on the regional level.
What are we doing to influence decision makers?
Okay, so I'm saying that on the regional level, we know very well that some of the powers are being possessed politically. Yeah. If you are buying or influencing the political way. So if if you haven't started to influencing the political will, what are your plans to influence the political will? Because we know if we influence the political will, it might be the future change.
Yeah.
And then they get the question online. Oh, they typed it out, okay, perfect, go ahead.
Can I respond to this?
Yeah, go ahead.
I do agree with that, but also like you have to take into consideration that with the political winds changing in our region, in which many of our countries have a very progressive legislations around HIV, that also is very easily taken away. So that's not, even though that's a big resource that we have in our hands, it's not everything, because you can have a very, it's what's happening in my country, in Argentina. We have an amazing national law that includes HIV cure research in paper, but the implementation doesn't happen. So how we are able to influence those decision makers, that's a very big question. I think that primarily what we can do and we can continue doing is that to making the case about the investment in terms of the cost of inactivity around HIV cure, but also we are in the middle of a movement that's retiring funding from research, because, and that's something that as a person living with HIV pains me a lot, because if in terms of cost effectiveness, people are much more willing, meaning funders, to put the money in something that can help people remain alive for the next 5 years rather than funding a long-term solution.
Okay, follow up on that. I'm saying that we do lots of the good things as an organization or as an active. But in most cases, one of the missing link that we normally left out is not to buy and influence or to bring about the policy change. By doing the community preparation is one or another strategy to try to make the policy change. So the next step is just to buy the political willingness.
Mm-hmm. And also how to make that community preparedness, and that speaks about doing a lot of community education so that people know what we mean when we talk about cure. A slogan that's very common in the Spanish-speaking LAC is Lac-Cura ya, which means like the cure now. But many people repeat that without having a full dimension of what that means, almost as if they were expecting tomorrow to wake up and receive a shot and the grass getting greener. And when we talk about cure, we speak about access to innovation. We speak about regulatory issues. We talk about even if the HIV stigma will continue once and if the virus leaves your body. So, I mean, there's a lot of alignment and coordination that has to back that commitment, both from the community that can lead to the advocacy work that will generate the influence. If only it was that easy.
Any questions online?
Can you define civil society members? How they work? Can you define civil society members and how they were recruited?
How they were recruited? The survey was disseminated online, and the kind of NGO, the kind of civil society respondents were activists, advocates, people from NGOs. I don't recall them by heart, but we assessed particularly what kind of civil society members they identified with.
Another question is, how will we measure whether Lac-Cura has truly shifted global cure power towards the region in 5 years?
How will we measure it? That's a great question. I think that we could measure it by how much the agenda has rooted the public conversation in regards to HIV, about how much people know about cure in terms of education and mobilization, in how much our perspectives as a region are included in the global agenda, and we have a great opportunity in this year's AIDS conference, particularly the HIV Cure Pre-Conference, in which 4 members of the region are part of the organizing committee, and how much investment and work can continue to enrich the perspectives of the work that's probably going to continue being done in the future.
Quest for a cure, rise and shine.